Welcome to St. Petersburg Together. I'm your host, Janice Ford. Finding good child care can be very difficult, but that job is even harder for parents of children with medical needs. The Kidz Club is one local group that helps meet these needs. Joining us now to talk about the Pediatric Medical Day Treatment Facility is Charlene Reedy and Gada Hassi. Thanks for joining us, ladies.
Thank you.
The Kidz Club provides specialized daycare services. Can you tell us a little bit about that?
Sure. We are what's referred to as a PPEC, and the acronym stands for Prescribed Pediatric Extended Care. And so children who attend our center must have a medical diagnosis. And most of the children who attend our center are covered by Medicaid, so there's no cost to the parent. The information is submitted, Medicaid reviews it, they make a determination, and then if they approve the child to attend, the child is able to start.
So what are some of the medical diagnoses and medical conditions that you treat there?
A wide variety, and actually I'd like to have Gada speak to that because she's our site director of nursing and she is an RN.
I also wanted to add that the medical diagnosis has to call for a need for nursing on a daily basis. A child that has a G-tube or dysphagia, a child that has seizures and is on medication would be appropriate for our center. We have children that have diabetes, children that have trachs. We have many diagnoses. A lot of them have CP or some other neurological disorders. And our facility is staffed by nurses, CNAs, and caregivers.
Because I was just going to ask, in addition to the nurses, do you have a doctor there on staff?
We do. We have a medical director here in St. Pete, Dr. Stephen Kargas. Okay. He is our medical director for the center in St. Petersburg. Okay.
And he's been there since you opened, haven't he?
Yes.
Okay, because I think I remember that name. What are the ages of the children?
We have children as young as newborns discharged from NICU all the way through 20 years old.
Oh, really?
The majority of the children that attend typically are between 2 to 3 months old and 4 to 5 years old. Okay. That's the greatest number population. Right. And as Gada had said, we do get children when they're discharged from the local hospitals, right out of NICU, CVICU, etc. And they're able to come into our center because we can provide that higher level of care. We also have children who attend our center that have medical conditions, but maybe they are going to school. We have some children who attend Nina Harris or some of the local Pinellas County schools, but they have that underlying medical condition. So when school is out, the parent needs that higher level of care. They can't just go to a daycare or have a babysitter. Right. So that's where we also have children come in, for example, Christmas break, Thanksgiving break, spring break, and over the summer. Right. And some children come to us before school and after school. So we're flexible. It's not a full-time or nothing. We have full-time, part-time, etc. And I'd also like to add that we just recently opened on Saturdays.
Oh, okay, because that was my next question.
Yes, we just opened on Saturdays. January 10th was our first Saturday. So now we're open Monday through Friday from 6 a.m. to 6 p.m. Okay. And on Saturdays currently from 7:30 a.m. till 5 p.m.
Okay. Now, when you were talking about the age range of the kids that you serve, and you said that they're up to 20 years old. Yes. Have you had teenagers and up to young adults like that?
We have had teenagers. I think the oldest teenager we've had since we've opened may have been 17. Right now the oldest one we have is probably 14 years old. Okay. And those are the kids that typically come during summers and possibly Christmas break and spring break as well.
Now, you said that some of the clients that you serve are also in regular schools, so they come to you after school.
Sometimes it's both before and after school. The school bus picks them up at our facility and returns them to the Kidz Club in the afternoon as well, where they would receive, either a G-tube feeding, meds, whatever nursing care they need at that time until the parents pick up by 6 p.m.
So that's what the next question is, do they attend full or partial days? So for those kids who go to regular school, it would be considered a partial day
Yes.
for them.
Yes.
Okay, so when they're in the regular school setting, there are no need for them to have any type of medical treatment at that time. They come to you all after school or before school to get that.
Some of them do get medical treatments. I know with schools such as Nina Harris, they have a nurse that
Right.
can administer the G-tube feedings. Some of them also receive meds during the day as well.
Right.
So, and they're doing that at our facility as well as at the school that they attend.
Right. Because I know that's a big deal at regular schools is, having them administer medication. Sometimes you run into a block wall where that is concerned because they don't like to dispense medication to students at school.
Right, and that varies, and again, Gada can speak more to the medical part of it, but for instance, we are seeing the uptick in children with type 1 diabetes.
Oh, wow.
So some of those children may go to school, but if they're having a crisis or it's not being well managed, they may come to our center until they can manage their levels well and get them stabilized. Another example may be a child who's had a surgery or had a regression or had a seizure, and it has, they're not cleared to return to school yet. Well, they're able to come to our center in the meantime, so they're being supervised by nursing care, and they can receive their meds, and then we also have on-site occupational, physical, speech, language, and feeding therapies. So we're able to capture the needs of the child in one setting.
Well, it's wonderful to know that we have something in the community that provide these services, because we know that there is a lot of kids and parents who probably need those type of services for their children.
Yes.
Where exactly are you located?
I was just going to state that we are located in the Webb's Plaza, which is 850 3rd Avenue South, St. Petersburg. And that is located at the intersection of Dr. Martin Luther King Jr. Street South and 3rd Avenue South. That's where the plaza is, and we're right in the middle of the plaza.
Right.
We're tucked right in the middle there. We have over 10,000 square feet. We're a large center. For people who have lived in the area for a long time, they know that that's where the Winn-Dixie was. And we often get that, wasn't there a Winn-Dixie here? So yes, there was. And that's right behind the AAA plaza. Also, I wanted to mention the location was chosen due to its proximity to All Children's Hospital, and right behind us off of 4th Avenue South is Fire Rescue Paramedics. So in the unusual or rare situation where we do have to do a 911 call if we're unable to stabilize a child, they literally get in their vehicles, and we're still on the phone with them giving all the details when they pull up to the front of our building. And then a child from our center, if they're 911'd out, is right to All Children's, and that's 4/10 of a mile from our center.
Right. I also want to mention that we do have your information, your website, phone numbers, and all of that we're showing on the screen as well while we're talking. Also some photographs about the center, pictures and things like that. But what about the cost? Who pays for the services?
Most, not all, but most of the major private insurance companies at this point are not covering the service.
Can I ask why?
I honestly do not know.
I
don't have a good answer for that.
Yeah, seem like they should be.
Yes, and that's one of the concerns or topics that I try to bring forward when I have the ability or the setting is if a private insurance or commercial insurance will cover private duty nursing, why wouldn't they cover our service? Our service is much less expensive because we're reimbursed, at Medicaid rates, and it doesn't socially isolate the child. Private duty nursing is a wonderful service, and there are situations where that is ideal. But then there's also situations where a child can still be out interacting with peers in a controlled environment, such as ours, and have all of those developmental experiences and sensory experiences, et cetera, and peer-to-peer interaction. So the private insurances, again,
Do not pay.
it's case by case. We
Okay.
will submit to find out if they will
You will
cover it.
pay.
But the majority of our children have some form of Medicaid. It may be Medicaid HMO program. It may be CMS or the PD Care program. And it may be what they call now fee for service, which is also known as straight Medicaid,
Right.
which is the formerly known as MediPass
Right.
generally to
And-
compare.
and basically, because these kids have these medical needs, is why they qualify
Absolutely.
for those services. So it's wonderful that that they do pay. Unfortunately, they have to have some type of condition like that in order for them to get the treatment that they need. And
Yes,
it's really-
we are, and the easiest way to put it is we are really purely medically diagnosis driven.
Right.
We get calls often from parents who have a child who may have a diagnosis of autism or a child who may have a diagnosis of developmental delay, or they may have been referred for speech or occupational therapy or physical therapy. Those children generally will not qualify to come to our center because what the criteria is through the Medicaid handbook for PPEC is why do they need some level of service intervention monitoring by nursing staff. And that's the defining difference. If there's medications that they have to take during the day, if they're seizure precautions, if they're having a recent, they have active seizure history. And Gotti, you could probably go into a little bit more detail about the levels of acuity and but it is purely medically diagnosis driven. That's the best. Now, some of our children do have a medical diagnosis, and then they also do have a diagnosis of autism
Right.
or developmental delay.
dual
Those aren't the
diagnosis.
qualifying
Right.
diagnosis. It's okay that they have that
that.
as a diagnosis, but it has to be that medical
Right.
piece that
They
gets
do
them
it.
approved.
Right, it's almost looking at the same diagnosis of sickle cell. We've had children approved because they're symptomatic quite a bit. They go into sickle cell crisis and need to be monitored by our nurses and cannot be at a regular school because of their symptoms. We've also had children where 6 months has passed and they've not had sickle cell crisis, and those children sometimes are discharged because of the lack of symptoms at that point. So it's hard to judge which ones
Right.
are appropriate simply looking at the diagnosis.
So you've had kids who've had sickle cell and they go through these episodes.
Yes.
And so if they're in your facility and they haven't had an episode for quite some time, then you discharge them, and then whenever they start back having them, they come back.
They could reapply.
They
The
could
children
but you have to
are-
reapply.
Yes.
Okay, that's what I was getting at.
The children are certified for a time period of 6 months.
Oh, okay.
And it's really helpful to the parents. I wanted to go back and add about the therapies at the center. Has been so helpful for our families who typically would have to leave work, come and pick up their child at daycare and take them to the therapist for the sessions they get, whether it's speech, OT, PT. And the therapies being available at the center has been really a
Helpful.
blessing to many
Yeah.
of the families
That's
where
good.
everything is taken care
Right.
of in one place.
That's wonderful. Now, tell me about the transportation. You mentioned something earlier about transporting kids to and from school, because they come to you. Parents can drop them off to you for before
Right.
and then come back. And
There's a
you all pick
couple-
them up.
Yes, there's a couple different scenarios,
Okay.
and this is probably a really good opportunity to clarify on those. One is we have probably, I'd say about 50% of our children are private transport. The parent or family member, someone's able to bring them to the center and able to pick them up at the end of the day.
Okay.
And then probably the other 45% ride our buses. We currently have 2 vans, transportation vans, for the Kidz Club. On each of our vans, we have our driver and there's a nurse assigned to the van. The van or the bus cannot leave the center without a nurse on it.
Okay.
So we go out, and currently right now, we have the 2 buses going out doing like 2 runs in the morning, 2 runs in the afternoon, picking children up, bringing them to our center. And then in the afternoon, same thing, taking them back home. And so if a family is unable to transport or they have to leave for work at a certain time, et cetera, we try to work around their schedules with our buses and provide that service for transportation. And currently right now, the furthest north we go is Ulmerton Road. So we do go fairly far north.
Yeah, that's pretty far up there.
And we have, we've had families that live in Clearwater and they're able to drive down to like Ulmerton Road or somewhere on Starkey to meet our bus.
Okay.
And then they can come on our bus. We really look at the time frames for our routes of our buses because by the very nature of the population that we're taking care of, we can't have them out on buses for extended periods of time. Infants need to be changed, they need to be fed, meds need to be administered. The nurses are taking vitals or and they're charting the status of the child. So that is one piece of it. Now another piece of it with regard to the school system is depending on the school that the child attends, and if the bus is able to accommodate that, when I say bus, the Pinellas County School bus, what can happen is Pinellas County Schools will pick a child up and drop a child off at the same location.
Okay.
So what has to happen is the parent has to be able to get the child to our center prior to the time the school bus would come to pick them up.
Okay.
The school bus picks them up from our center, takes them to school, school bus takes them from school, drops them at our center. Pick up, drop off, same location. Okay. Then the parent would have to pick the child up from our center. Unless the child gets dropped off at our center by the school bus early enough to then ride our bus home. Okay. So it's a balancing act and a scheduling of when is the public school bus running versus when are our buses leaving.
Okay.
Yes.
Tell me, what does a typical day at the Kidz Club, what does that consist of?
Oh, absolutely, Gada. I will.
I can tell you from a nursing point of view, the children come in and the very first thing, each child gets a physical assessment head to toe. Shortly after that, breakfast is scheduled. Each class, each age group is divided into their own classroom.
And you have to adhere to special diets for those kids?
Yes, we do. We have many special diets going on,
you
and we have a wonderful full-time cook and an assistant that are extremely knowledgeable with diabetic diets. Some of them are puree. They do that very, very well. So breakfast is served shortly after the assessments, and then each room has classroom time with our teacher. We have a teacher that sees all 5 of the classroom ages. She even goes into the transition room, which is the next step up from the infants, just to interact with the kids, even though at that time, at that age group, they're, they're crawling, they're beginning to eat table foods. She'll sit there and she'll read them a story or, do songs with them. They get to be with their own age groups at the same time. They also have lunch and snack, at the center. And in the afternoon, they get focused assessments. Between the morning and the afternoon assessments, many children get breathing treatments, G-tube feeds possibly. A lot of them have meds, whether they're diabetic, and we're checking their blood glucose levels. They're getting their meds at the same time. We have nap time for the toddlers and pre-K kids. And after that, they're usually either picked up or going home on the Kidz Club bus. And our buses are full. I know both buses.
Buses
do 2 runs.
You probably need to buy another bus.
Exactly.
That's actually being discussed literally as we speak about getting a 3rd bus. And we have just hired some additional part-time drivers as well. And also wanted to add on to that, we do have a playground out back as well. Okay. So our playground, the center of it has that ground up rubberized texture, so it's a soft, has some give to it for our little ones. And we have a big shade canopy over the playground as well.
And the toddlers in pre-K, they do go outside. If weather warrants, they go outside almost always. We also bring in a lot of activities for the kids. We've brought in story time from the library, puppet shows.
Yes.
We do a lot of dress-up days. We do spirit days. We try and make it as enjoyable as possible for the kids, and the staff usually gets in on it. So it really is a fun place to be.
Okay.
And another point to follow up on that is a lot of people will ask us, oh, does it look like a nursing home for children? And you have been there, you've seen it. And it does not. So I would like to just mention that. It is a beautiful center, and I would encourage or challenge anyone coming in, if they didn't walk in knowing it was medical, they would never pick up on it.
And it is a beautiful facility. It does not look like a nursing home at all. So you would never think that once you walk through the door.
It looks like a
Yes,
typical
it does.
daycare setting, bright colors, and from the pictures, there's projects hung all over that the children have done. One thing I wanted to back up to is when you're asking about additional services or what a typical day looks like, I also wanted to mention some of the outside services that we do have in addition to the occupational, physical, speech, language, and feeding therapies. We also have hospital homebound through Pinellas County Schools. So any child who is 10 months or older, we can make the parent aware of the program, and if the parent agrees and authorizes, we can get the child enrolled with Pinellas County Schools, and a hospital homebound instructor sees them at our center, so they start getting that school readiness for curriculum and preparation. We also have vision services from Pinellas County Schools and Lighthouse of Pinellas, and we have the Therapy Dogs International visit our center twice a month as well.
Aware of that program. It's a
Yes,
wonderful program.
it is. The children love it, and
I'm
we'd
sure.
love to have them come. So we
As a matter of fact, the mayor trains therapy dogs.
Oh,
Yeah.
okay.
That is wonderful. Those are in all the services that you provide. You also provide those additional services to those kids. That is great. So how can a kid get referred to the Kidz Club? What's that process like?
It's very informal and very easy. Parents will call us directly. They can pick up the phone and call our center. They'll talk to one of our nurses. They'll get some additional information, ask for some details to make the determination, does this child look like they may have that qualifying medical component? The nurses are really good at getting that information and trying to help decide that. Then they would schedule a time for the parent to come in at the parent's convenience to sit down and meet with one of our nurses. And then they would go through and do the physical assessment. Gada can speak to that more so from the nursing perspective.
They would come in, have a full physical assessment. We usually do the history with the family as well and submit everything more frequently to the pediatrician. And once in a while we submit to specialists, whether the child has diabetes or cystic fibrosis or sickle cell. A lot of those special ones go to the specialist that's involved. And once we get the approval from the physician, we come up with a care plan for that particular child, and we send it off through EQ Health to submit to Medicaid. And at that point, a case manager is assigned from EQ Health that will interview the family and come meet with the child and make that decision, whether the child is appropriate for our center.
Okay.
We also, I'm sorry, I didn't mean to cut you off. To further answer that question, pediatricians' offices will call us. A variety of local programs. I'm active with a lot of community organizations. So sometimes they may be going to a typical daycare, or the sibling goes to a typical daycare and they can't take this child because of the medical needs, so daycares will refer to us. There's different organizations, Early Steps, social workers, case managers, child protective investigators. It's a very open referral process. It's basically someone picks up the phone and calls us and says, this family may need you.
From the first initial phone call to the actual placement, how long does that take?
I would say generally now probably to allow 3 weeks. Often less, but there's just the process of we have to send the documents to the doctor. The doctor has to sign off, send them back to us. We have to send them to Medicaid. Medicaid has to review, give us an answer. As soon as we have an answer, our nurses are on the phone saying, your child's been approved, when do you want them to start?
Okay, so a few more questions before we have to go. This is so interesting. What is your capacity?
We are licensed for, I believe, 83 children in our center.
Okay. I would imagine you probably at capacity all the time, are you?
No, currently right now we're averaging low 50s of children attending daily, and then depending on the number of children when school is out, we have those spikes.
Okay.
But at the same point, sometimes families don't send the children when school is out because the other siblings are home and they want to
Okay.
have the whole family together.
So you very rarely have a waiting list.
We have not yet.
Okay.
No.
Okay. Any other information you want to offer before we close it out? Contributions?
Just that it's a great place and it's very helpful to the families and great for the children.
Right.
And if anyone ever just wants, a parent or a family member or a caregiver just wants to come see what it's about, just give us a call or just come. We're there.
Okay.
We're open. And,
All right.
and one of our nurses will be happy to show them through.
Okay, and you have that information on the screen, the contact information. Thanks again for joining us today. Here's where you can go to learn more about the Kidz Club. I'm Janice Ford. Thanks for watching St. Petersburg Together. See you again next time.